I don't typically bring this up during routine hospital visits because, truthfully, most people dismiss it. But this seemingly harmless symptom might be more than skin deep. I'm Dr. Charles Chuck Miller, an oncologist with over 5 decades of experience, and I'm now 88 years old. After treating thousands of patients, I've come to realize a surprising fact. An itch can sometimes be a red flag, an early indicator of cancer. Let me ask you this. Have you had a certain spot on your body that keeps itching no matter what you do? You've slathered on creams, tried every lotion on the shelf, and still, nothing helps. Most people just shrug and say, it's probably just part of getting older. But let me warn you, that kind of thinking can be dangerous. Yes, I'm still seeing patients twice a week at the clinic, Tuesdays and Thursdays. Even at 88, I'm standing strong on the front lines of medicine. One reason? I pay attention to the body's whispers before they become screams. Today, I want to talk about a hidden danger behind a seemingly innocent itch. Last winter, a 75-year-old gentleman, Mr. Johnson, walked into my office with a peculiar complaint. Doc, my lower leg gets unbearably itchy after I shower, and always around 3 a.m., he said. He tried all the usual fixes, ointments, moisturizers. Nothing gave relief. Initially, I thought it might be simple aging-related itching or eczema, but something about his story didn't sit right. I don't see anything wrong on the surface, he told me. So why does it itch so badly? It didn't feel like a normal dermatological issue. I suggested a more thorough evaluation. What we discovered shocked us both: early-stage lymphoma. I still remember what Mr. Johnson said when we got the diagnosis. I just figured it was part of getting old. And that's when it struck me, how many warning signs like this had I overlooked in the past? Since then, I've encountered more cases like his. A 68-year-old with an unrelenting itch between the shoulder blades turned out to be pancreatic cancer. A 73-year-old man with. There was another case I'll never forget. An elderly gentleman suffering from relentless scalp itching. No visible rash, no dandruff. The diagnosis? Pre-leukemia. Since that day, I've never brushed off unexplained itching again. That very night, I sat in my office, flipping through decades of patient files. What I found was chilling. Nearly 30% of my cancer patients had reported persistent, localized itching in the 6 months leading up to their diagnosis. This wasn't coincidence, it was a pattern. I dove into the research, digging through medical studies, old case reports, and speaking with fellow physicians. Eventually, a clearer picture emerged. There are 6 specific areas of the body where unexplained itching may serve as a warning sign of cancer, especially in people over the age of 60. So I urge you, watch this until the end. This knowledge could be life-saving. And if you find this information valuable, please like and subscribe to help more people hear it too. Today, I'll share 2 crucial things. The 6 body regions where persistent itching might indicate cancer. Simple self-checks you can do at home if you're currently experiencing itching. Let's begin with the first one. 1. The lower leg. We start with the lower leg, particularly the front portion. If you've been experiencing constant itchiness in that area, don't ignore it. This could be an early indicator of lymphoma. Here's why. When the lymphatic system becomes inflamed, it can release chemicals that stimulate nearby nerve endings, creating that intense urge to scratch. But this isn't your typical dry skin itch. It feels different, deeper, almost electrical. Let me return to Mr. Johnson's case. A 75-year-old man who came to see me last winter. For about 3 months, he'd been battling persistent lower leg itching. What began as a mild annoyance turned into a nightly ordeal, especially around 3 a.m. Every morning, Mr. Johnson would wake up scratching the front of his lower legs. The itching was so severe, it robbed him of sleep. And no matter how much he scratched, it offered no relief. In fact, it only made things worse. He found the whole thing baffling. At first, he assumed it was just poor circulation. So he tried everything: leg massages, warm towels, even compression socks. His wife, deeply concerned, went out and bought high-end moisturizing lotions, hoping they would help. But nothing worked, not even a little. If you're dealing with something similar, here's a simple self-check you can try at home. Apply moisturizing lotion or an over-the-counter anti-itch cream 2 to 3 times a day for a full week. In most cases of common skin irritation, like dryness or eczema, this should noticeably improve the itching. But if the itching is related to lymphoma, these treatments won't help. In fact, it may actually get worse. Another key red flag is when the itching intensifies. In the early stages of lymphoma, itching typically gets worse at night. You might feel fine during the day, but as soon as you lie down to rest, the sensation returns, sometimes even stronger. Why does this happen? Because the lymphatic system becomes more active at night, especially when you're lying down. The circulation slows, the immune system ramps up, and that's when the itch deepens. It's not something a cream can fix because it's not a skin issue, it's an internal immune reaction. So here's the bottom line. If your lower legs have been itchy for more than 3 weeks and nothing topical seems to help, it's time to consult a hematologist or oncologist. Thankfully for Mr. Johnson, he was diagnosed early. With prompt treatment, he made a full recovery. And here's the good news. When caught early, lymphoma treatment has up to a 90% success rate. So ask yourself, have you been dealing with unexplained, stubborn itching? Every morning, Mr. Johnson would wake up scratching the front of his lower legs. The itching was so severe, it robbed him of sleep. And no matter how much he scratched, it offered no relief. In fact, it only made things worse. He found the whole thing baffling. At first, he assumed it was just poor circulation. So he tried everything: leg massages, warm towels, even compression socks. His wife, deeply concerned, went out and bought high-end moisturizing lotions, hoping they would help. But nothing worked, not even a little. If you're dealing with something similar, here's a simple self-check you can try at home. Apply moisturizing lotion or an over-the-counter anti-itch cream 2 to 3 times a day for a full week. In most cases of common skin irritation, like dryness or eczema, this should noticeably improve the itching. But if the itching is related to lymphoma, these treatments won't help. In fact, it may actually get worse. Another key red flag is when the itching intensifies. In the early stages of lymphoma, itching typically gets worse at night. You might feel fine during the day, but as soon as you lie down to rest, the sensation returns, sometimes even stronger. Why does this happen? Because the lymphatic system becomes more active at night, especially when you're lying down. The circulation slows, the immune system ramps up, and that's when the itch deepens. It's not something a cream can fix because it's not a skin issue, it's an internal immune reaction. So here's the bottom line. If your lower legs have been itchy for more than 3 weeks and nothing topical seems to help, it's time to consult a hematologist or oncologist. Thankfully for Mr. Johnson, he was diagnosed early. With prompt treatment, he made a full recovery. And here's the good news. When caught early, lymphoma treatment has up to a 90% success rate. So ask yourself, have you been dealing with unexplained, stubborn itching? Have you been feeling unusual itching in your lower legs recently? 2. The middle of the back. Next, let's talk about a commonly overlooked spot, the middle of the back. Few people know this, but the nerves in this area are directly connected to the pancreas. When the pancreas becomes distressed, especially in the early stages of pancreatic cancer, it can trigger an itch in the back, even though the real problem is elsewhere. This is called referred pain. The issue starts in one part of the body but shows symptoms somewhere else. Not long ago, a woman named Ms. Williams, age 68, came to my clinic with an odd complaint. She had a stubborn itch right in the middle of her back. She tried everything: replaced her mattress, switched pillows and blankets, deep cleaned her house, even tossed out her rugs and sofas. Still, the itch remained. She told me, "Doctor, we practically turned our home upside down, thinking it was dust or mites, but that same exact spot still itches." She had even gone for allergy testing and was prescribed several topical creams, but nothing worked. Her itch had a pattern. It got worse after dinner. She thought it might be a food reaction, but the itch appeared no matter what she ate. Here's a way to check yourself at home. Using your fingers, press gently on the itchy spot. If it feels uncomfortable, heavy, or slightly tender in a strange way, that might point to pancreatic involvement. This kind of itch feels different than a normal skin irritation. Also, take note of your digestion. The pancreas produces enzymes that help break down food. If you notice digestive discomfort, especially after eating oily or fatty meals, and you're also experiencing mid-back itch, it could be worth checking further. Many people assume back itching is just a sore muscle or skin dryness. But if there's no rash or visible skin condition and nothing relieves it, it's worth getting a medical checkup. Have you had odd back itchiness lately? 3. The scalp. Let's move on to the scalp. Persistent scalp itching, especially when there's no visible irritation, can sometimes be a warning sign of leukemia. With leukemia, the body overproduces white blood cells, and this releases inflammatory substances that irritate tiny nerve endings in the scalp. Often, the itching is strongest behind the ears or near the neck. One patient that stands out is Mr. Harris, a meticulous 73-year-old man who kept a journal tracking his symptoms. "Doctor," he said, "I've been documenting this itch for 3 months, when it starts and when it gets worse." He thought it was a shampoo issue and switched to milder products. He even stopped using conditioner, tried just soap, and adjusted his washing routine, but nothing worked. There was no dandruff, no redness, yet he constantly felt the urge to scratch. The strangest part? He barely felt it during the day. It flared up at night, especially when lying down. Here's how to check for yourself. Gently run your fingers across your scalp. If certain spots feel warmer than others, or if the itching feels deep and nerve-based, it could be an inflammatory response related to blood health. Leukemia-related itching often follows a pattern. Worse at night, absent during the day. This is because your blood flow changes when you lie down, distributing the inflammatory agents differently. Also watch for accompanying symptoms: fatigue, slow healing of cuts, easy bruising, or bleeding gums. If you notice any of these, it's best to get evaluated by a specialist. Have you experienced a strange, persistent itch around your scalp or behind your ears recently? 4. The chest area. Now, let's talk about chest area itching. This is especially important when it involves just one side of the chest. Such symptoms could point to inflammatory breast cancer, or in rarer cases, male breast cancer. Unlike typical breast cancers that form lumps, inflammatory breast cancer often presents differently. The skin may become irritated, thicker, or take on a texture similar to orange peel, and the first symptom is often itching. Ms. Davis, a 69-year-old patient, visited me a few months ago. She told me, "Doctor, the spot where my bra touches keeps itching. I thought it was just the fabric." She tried everything: cotton, silk, bamboo bras, and even went braless in loose clothes. Still, the itch persisted, and it was only on the right side. Here's what you can do. Stand in front of a mirror and carefully compare both sides of your chest. Is one side slightly swollen? Is there a color difference or thickened skin? These can be early signs of inflammatory breast cancer. Ms. Davis had some mild redness, too. Often, this type of cancer begins around the nipple area or beneath the breast. And if the itching is only on one side, it's a stronger sign. In men, this is rarer but still possible. About 1% of all breast cancer cases occur in men, usually in those over 60. So if you're male and experiencing nipple itchiness or chest skin changes, don't ignore it. Even without lumps, deformed skin and persistent itching should prompt a visit to the doctor. Inflammatory breast cancer tends to spread quickly, but with early diagnosis, it can be treated effectively. Anyone here had persistent, unexplained itching in the chest area? 5. Around the anus or reproductive area. Let's move on to one of the more sensitive regions: itchiness around the anus or genital area. While many might assume this is due to a rash, yeast infection, or hemorrhoids, it can sometimes be a sign of anal cancer or vulvar cancer. Here's what happens. A growing tumor in these areas can press on nearby tissue and nerves, triggering a stinging, itchy sensation that feels deeper than a typical skin irritation. Mr. Ryan, a 76-year-old man, came to see me about. Mr. Ryan, 76, had dealt with hemorrhoids for over 30 years. So when he began to feel itching around the anal area, he naturally assumed it was another flare-up. He told me, "Doc, I've had this before. I know the feeling, but this time it's different. It doesn't hurt when I sit or use the bathroom. It just constantly itches, even when I'm at rest." He started using more hemorrhoid cream, took warm baths 3 times a day, and eventually even underwent a minor procedure. But the only thing he kept hearing was, "Everything looks normal." Here's how you can check for yourself. Pay attention to the exact spot of itching. Hemorrhoids and common inflammation usually cause broad discomfort. But with cancer-related itching, it's often centered in one small area and feels sharp or prickly, like needles. Track the itch over time. Normal irritation tends to ease with time or treatment. But cancer-related itch typically worsens, especially at night. Mr. Ryan said nights were the worst. He couldn't sleep. Watch for additional symptoms: rectal bleeding, changes in stool texture, painful urination, unusual discharge, or foul odors can all be warning signs. Treatment response is also revealing. Creams, baths, and ointments might soothe normal issues, but if the problem doesn't improve or worsens despite consistent treatment, it's a red flag. And remember, don't let embarrassment delay your care. Many people ignore serious symptoms because they assume it's just something I've always had. That delay can be costly. 6. The hands and feet. Last but not least, let's talk about itchiness in the palms and soles. If you're experiencing persistent itching only in these areas, it's something to watch carefully. This can sometimes point to internal cancers. Why? Because toxins from cancerous cells can circulate through the blood, irritating peripheral nerves, especially in the hands and feet. One of my most surprising cases was Mr. Allen, age 70. His palms itch constantly. He thought it was just irritation from cleaning, so he began wearing gloves, switched soaps, and applied moisturizers 5 to 6 times daily. He even wore cotton gloves at night and reduced hand washing. Still, the itching persisted. The backs of his hand were fine, but the palms, especially the lines, drove him crazy. Here's how to check at home. Look closely at your palms and soles. Is the skin slightly yellowish? Do the natural lines appear deeper than usual? Note the itching pattern. It's often both hands and feet, worse at night, and doesn't respond to normal treatments. Regular itch relief, like cold water soaks or lotion, might help temporarily, but won't fully relieve the sensation if it's linked to cancer. This type of itch is often misinterpreted as eczema, diabetes, or circulation issues, especially in older adults. But if the itching is limited to the fingertips or soles, and it's been going on for more than 3 weeks, you need a thorough checkup. Self-diagnosis: 5 steps to catch it early. Now, let me teach you 5 simple self-diagnosis steps. They can help you detect potential problems early, when treatment is most effective. The 3-week rule. If the itch lasts longer than 3 weeks, it's probably not a minor issue. Most skin problems resolve in a week or 2. Track your symptoms with a calendar, and if they persist past that window, get evaluated. Lotion response test. Apply a moisturizing or anti-itch cream 2 to 3 times daily for a week. If it's just dry skin or mild irritation, it should improve. If it doesn't or worsens, internal factors may be involved. Check for side symptoms. Itching rarely comes alone. If you've lost 5 kilograms, 10 plus lbs, in a month, feel unusual fatigue, or run a low-grade fever, these are systemic warning signs. Itch pattern analysis. Record when the itch worsens. Cancer-related itch often intensifies at night and targets one specific area over and over. That's a very different pattern from typical allergies or skin issues. Family history review. If your parents or siblings have had cancer, your risk may be 2 to 3 times higher. Pay extra attention, especially if the cancer type is the same. Don't miss these subtle signs. Early checkups save lives. Final summary and life-saving advice. Thank you for sticking with me through this important topic. Let's quickly go over the key takeaways. Lower legs, persistent itch, especially at night, may point to lymphoma. Middle back, if itching is paired with digestive trouble, consider early signs of pancreatic cancer. Scalp or behind the ears may indicate leukemia, especially if worse at night and no shampoo helps. Chest area could be inflammatory or male breast cancer. Even if no lump is found, look for redness, swelling, or thickened skin. Anus or genitals. Itchiness that doesn't respond to normal treatment could be anal or vulvar cancer. Palms and soles, especially if itchy only in those areas and worse at night, could be tied to internal cancers. Now revisit the 5-step self-check. 3-week rule. Lotion test. Side symptom check. Itch pattern tracking. Family history review. Most importantly, not all itching is cancer, but some cancers begin with itching. Don't dismiss signs just because you're aging. Trust your body. Be proactive. I'm 88 years old and still treating patients today because I believe in listening to the small signals. They save lives. If you want to take action today, here's a simple step. Tonight, before bed, check your body. Where's the itch? What does it get worse? How long has it been going on? Write it down. Monitor it. If anything you've heard today sounds familiar, please see a doctor. Be honest. Describe the timeline, symptoms, and patterns clearly. Your health matters more than anything. More than money. More than status. Let this video be the moment you took your first step toward a healthier future. In our next video, we'll talk about the hidden health warnings behind common symptoms of aging, like joint pain, digestion issues, and headaches. If you found this information helpful, please like, subscribe, and turn on notifications so you don't miss what's coming next. And most importantly, share this video with someone you love. It could truly make a difference in their life. Start now. Where will your health be in a year? Hopefully, stronger, happier, and full of energy.